I started to find that a lot of women were coming to me asking for help with prenatal care, very afraid actually of pregnancy. That was the biggest thing I noticed. Women were genuinely afraid to get pregnant or afraid to deliver babies. And I started to ask myself, this is such a gift. This is a beautiful thing. This is a miracle. So why are so many people afraid? That led to me writing a book. I call it Cherishing Pregnancy. That I didn't know that that would start a bit of a pivot. So, in addition to the weight loss and the inflammation reversal, to really hone in on helping women prevent complications in pregnancy.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hello, hello, hello. Hi, everyone. Welcome to another episode of The Care Room with Dr. Cindy. Today, I have an extra special guest, Dr. Larissa Assam, with us. And she's extra special because we went to the same med school. So it's like coming it's like coming full circle having her on the podcast today. She's super awesome. I know you guys are going to love this episode and what we talk about because it's right up our alley. But before we dive into things, I'm going to let Dr. Assam introduce herself.
Amazing. Thank you so much, Dr. Ejevwe, for having me on. And I shared the exact same sentiments. This
Yes.
is indeed very full circle,
Yeah.
and I have to say about Dr. Ejevwe, she was always so sweet. Like she carries such a sweet spirit. I remember, we may not have talked every single day, but every time
Right.
we did talk in medical school, I distinctly remember, you just having a very calming presence, a very sweet voice. And so it's amazing that, you've started your own practice now. I'm sure your patients are just so blessed to have you. And, this is amazing. This is like a reunion,
I
podcast,
know.
all the things in once.
Yeah, it is. It is. Oh, thank you for that. That was very sweet. I'm really touched. I will just so we can get through it. I'll move on. But thank you, Larissa. Thanks for sharing that. So I wanted to let our audience get a deeper look into what you do because what you do is so phenomenal. I know that you've been seeing a lot of results in your clinic. I know, so you do a lot of weight loss, obesity kind of medicine, and you also do a lot of prenatal care for women. Totally up our alley. If you can, tell us more about what you do and how you do it so well. Give us the details.
The short answer is by the grace of God.
Yeah,
Truly.
absolutely. Absolutely.
Yes, but at Rophe, by God's grace, so I'm board certified in family medicine. And so immediately after residency, I started my private practice, Rophe. And within the first year, actually, of private practice, I realized very quickly I had a very unique patient demographic. People who didn't like being on medication, people who had seen many doctors and just weren't getting the results that they wanted to see. So within our first year of private practice, we started developing protocols, personalized protocols, I like to call them. And that led to our patients losing over 500 pounds cumulatively in the first year. And that was with a very low patient volume, just starting out
Right.
the direct primary care model from the ground up. And
Right.
the average weight loss was about 10 to 15 pounds per month. And for me, the best part was it's not having an issue with any medications or anything, but the best part was they didn't need the medication. They were actually able to do this just based on their lifestyle. So
Okay.
we had people who were on medications for high blood pressure, diabetes, etc. But because of these because of the weight loss, because of the
Right.
changes in their bodies, they were able to come off these medications. And, I remember distinctly, it really touched me because I had done so much inpatient management of diabetes that I had a patient who was on 64 units daily of insulin, and that's the maximum daily dose. And within 6 weeks of working together, I actually had to take him off insulin altogether. I had to cut down
Whoa.
progressively. And 6 weeks later, he was off of it completely. He had lost over 20 pounds. And the best part is he had kept it off 3 months
Okay.
later. So it's not just a matter of losing the weight. It's not just a matter of coming
Right.
off medication, but it's a matter of the sustained results. So checking the
Right.
labs, checking the biometrics, even months later to make sure. So it's been humbling. It's been great. Since then, I started to find that a lot of women were coming to me asking for help with prenatal care, very afraid actually of pregnancy. That was the biggest thing I noticed. Women were genuinely afraid to get pregnant or afraid to deliver babies. And I started to ask myself, this is such a gift. This is a beautiful thing. This is a miracle. So why are so many people afraid? And the reasons are complex, they're quite many, but that led to me writing a book. I call it Cherishing Pregnancy. That I didn't know that that would start a bit of a pivot. So in addition to the weight loss and the inflammation reversal, to really hone in on helping women prevent complications in pregnancy. And the nice thing is this is done in a virtual setting.
Okay.
Women have the option to just have, and I have a lot of patients who are very busy. So that tends to work well with them. They're traveling quite often. And yeah, that's what we're doing at Rophe. Here we are 2+ years later by the grace of God, and we're going.
My God, congratulations. This is just amazing, the results you're talking about. So you're located in Maryland, correct? I think
Yes.
it's
Yes.
Rockville.
I see patients primarily in Maryland and Connecticut.
Okay. And is it entirely telehealth or are they able to come into the office to see you?
At the moment, it's entirely telehealth, or
Okay.
they have the option to do home visits. Though, to be honest, I haven't done a home visit in a few months. I would say the split is probably about 90 to 95% telehealth and maybe about
Okay.
5 to
Okay.
10% home
Okay.
visits.
Okay. Just asking for if anyone is listening and they heard these amazing results and they want to find you. So Dr. Assam, tell us, are you able to reveal your secrets? What is it? I know, right? What is it that gets a patient to lose weight without having to rely on medications as much?
Yeah, so the short answer is it's multifactorial and it depends.
Okay.
That's a very I have a background in public health. That's an epi answer, we used to call it. And
Okay.
it depends. But there are different things that cause people to gain weight or to struggle with losing weight. Sometimes people aren't gaining, but they're struggling with losing at the same time. And so
Okay.
oftentimes the root cause is something, some condition in the body. It could be hormones, it could be inflammation, but there's some root cause that is preventing this person from being able to optimize their health and shed the weight. I carry an understanding that we're all so uniquely created and we're all so different. But I believe
Absolutely.
truly that everyone has an optimal weight, an optimal body frame. For example, someone who's 6'2" is very different from someone who's 5'3", and they may weigh the same amount, but it's going to look and feel very differently based on their body frame. And also, when we then take a deeper look into what they're eating day in and day out, we then start to see that it's a bit more nuanced. So there's the scientific portion of it, which is very multifactorial. There are inflammatory growth signaling pathways involved, hormones involved, etc., etc. But these are the things that make it complicated and hard to translate for patients. So what we've done at Rophe is take the science, take what we know about food, take what we know about fasting, take what we know about fitness, and make it very easy to follow. Like, basically, what we're doing at Rophe is translating the science, right, with all these different scientific pathways into very simple to follow literally day-to-day steps, like a simple protocol for patients to follow. We look at blood work, we assess their food, we assess their fitness, and make it easy for them to basically, all they have to do is show up and follow the directions. That's really it.
Right.
And it looks different for everyone because, some people come and say, wow, I realized, like, yes, I had the issue with weight, but I didn't know how bad my sleep was until I started.
Right.
I didn't know how bad, how much my knee was hurting until I woke up one morning and realized, oh, I'm not limping anymore. So it's really getting to the root of it, which oftentimes is inflammation.
Okay. So when you say inflammation, like practically speaking,
Mhm.
do you work with patients' motivation? Do you kind of stress diet and exercise? What can they expect with your protocol?
Okay. Thank you for asking. The goal is to make it as easy to follow as possible. So I am a huge proponent or believer in the food as medicine movement.
Okay.
Definitely, diet is a huge factor, huge, huge factor. And the protocol emphasizes that. It makes it very clear over a 12-week period what they should be eating. I expect that people will start to see results as early as week one, but
Okay.
make it sustainable and to kind of go against that quick, rushed mentality, which oftentimes we tend to have. I usually ask for at least 12 weeks so that we can check labs before and after to see a noticeable change. Because we don't want to just say, oh, yeah, I've lost weight, but what happened biochemically in the person's body as well during that time period. I think it's very important to assess. And then on top of that, we offer fitness classes. So my patients have classes. Everyone who's a member has automatic access 3 times a week. I'm working out with them. We're literally all working out together. So you can't say, "Oh, doc, I couldn't know we're working out from the comfort of our homes, right?
Nice.
If you miss
Accountability right there.
if you miss
Yes.
a
I love
workout,
it.
you get a text. And I mentioned earlier, a lot of them are very busy. So we also have an in-house chef actually for those who are interested in meal prep services. They have that option as well to be
Wow.
meal prep I mean, I've literally tried to think of every potential barrier and it
Okay.
changes. This is not what it was on day one, right? So
Right.
I
Right.
truly believe it's evolved. We've iterated on it so much, but trying to think of every potential barrier and
Yeah.
making it possible for them to literally just have to show up and do what they're told. And then 12 weeks later, let's see how things are looking. Literally.
That's awesome.
Thank
That is amazing.
thank you.
Oh my gosh. So, in terms of like the benefits, I know you had mentioned like with that patient, his insulin dose kind just not even just decreased, it became non-existent. Can you tell us the benefits that you're seeing with those patients?
Yeah, absolutely. Well, he's one example I can mention with diabetes, but there are a lot of people who are pre-diabetic as well.
Right.
I was just reading an article last night, and it said the rates currently in America, based on recent stats, are 1 in 3. I'm forgetting the age group, but essentially about 1 in 3 people in America are dealing with prediabetes. And that's very high. So the key is sometimes it doesn't even need to progress to full blown diabetes. We can catch it in that borderline phase and reverse it. There are people who, I have that a lot of prediabetes, a lot of borderline hypertension, prehypertension. I had another patient, he'd been on amlodipine for blood pressure for over 10 years. So we started working together. And a month later, he was off the medication. And he was a remarkable case because he specifically had been put on a second medication right before we started working together. He was put on second medication. Unfortunately, he developed a side effect from the
Mm,
medication and that had kind of scarred him and he was just not the best place, not really trusting the medical system too much, and as you
absolutely.
can imagine, wanting to be off all medications. So within a month he was able to not only no longer need 2 meds but actually come off even the one he had been on for over 10 years. And then I also have to talk about pregnant patients. There's so many potential complications in pregnancy, but I've worked with women who've had preeclampsia in previous pregnancies, have been very afraid of developing it again, whether pregnant or postpartum, but then have had perfect blood pressures and had no preeclampsia throughout their pregnancy because we have a pregnancy protocol that they follow as well whilst pregnant. And they too are expected to show for the fitness classes whilst pregnant and postpartum. I had a patient in particular, she was diagnosed with gestational diabetes. She was put on insulin. And within about 3 weeks of working together, because she had just been put on it, she was able to come off insulin. She didn't need it anymore. But more importantly, we talk about diet control gestational diabetes. And I found when I was going through my training that sometimes you wanted to really get more in depth with patients and explain, eat this, don't eat that, etc., etc. And there was a bit of a time constraint that we would have just based on the insurance model. And I love what we're able to do at Rophe because it's not rushed. They can text anytime, they can ask any questions. I really think eliminating all these barriers and gaps in care are the things that are really helping us see these outcomes. So I'm grateful.
Oh my God, that sounds amazing. Tell us more about the pregnancy patients. Do you deliver? I know you're family med. Are you family med OB trained? Okay.
Yeah, so I did a pretty intense family med training and we did a lot. I did like the women's health, a big focus on women's health, not knowing at the time actually that I would do this. And I didn't do the OB fellowship. I contemplated it very strongly whilst I was on my OB rotation, but a lot of it is actually the clinical portion. So the clinic day-to-day prenatal preparation, right, for delivery, and then also postpartum care. When I was going through training, postpartum, the standard was 6 weeks. But at Rophe, it's actually a year because, yes, because there's so much that happens to women, especially when it's the first pregnancy,
Yeah.
postpartum, learning how to
Yeah.
breastfeed.
They call it what? The fourth
What's that's it.
trimester.
That's exactly it. Sometimes women develop postpartum depression, anxiety, and these things are missed because they're not really being screened for after the fact. So we actually have an in-house pregnancy community. We meet every other week. So in addition to the fitness classes and all the other things, they also get to meet together every other week. And they're on the protocol. We're checking in, seeing how everyone is doing. Actually had a patient deliver last week and she kind of walked her throughout her labor went in, and within just about 2 pushes, I want to say, the baby was out. So those moments, they just never get old. it's,
They
it's a
don't.
blessing.
They don't. But bless you guys' heart. OB. I think I I love, don't get me wrong, I have two of my own. I love, that feeling of, you get your prize at the end. Uh, and I loved watching it, like on my OB rotation. I think I was just scarred
Yes.
by, like the whole process, and, seeing things coming out of both ends sometimes. And, I knew it wasn't for me.
Yeah. And can I be honest? I would never have thought I would be focusing on women's health, that I would
Yeah.
be doing OB or prenatal care.
Yeah.
Absolutely not. I mean, I didn't have the best medical school rotation, to be honest.
Yeah.
It just wasn't the best experience. And on top of that, I felt it was a bit too much. I actually wanted to do plastic surgery when I was in medical
Ooh.
school and then literally converted to family medicine. And even within that, I still did not think that women's health would be my focus.
Sure.
So
Sure.
it's something that I can understand what you're saying, is what I'm
Yeah.
saying, because I didn't think I would be doing it either, basically. But I love it. I think the love really came, truly.
Yeah, yeah. And I do a lot of women's health. I think sometimes it kind of falls to us, and I love it. I love the women's health, but I think it's the OB part
The
that I'm
OB
like,
portion
I'll
in
leave that
particular.
to others. But I think it sometimes falls into our lap, as female physicians too, that, there are some patients who just feel more comfortable, they're drawn to us, and, we end up, becoming really good at it and just, doing it.
Absolutely.
I totally, totally get it. So, Rophe sounds amazing. Can you tell a listener who's listening how they can get enrolled? How can they find you to get the results that you're talking about?
Absolutely. So we are listed on Google, Rophe, a simple Google search, Rophe, or searching my name, Larissa Assam, and Rophe together will bring up our Google listing. And that's a great starting point, actually. We have our website, which is rophe.card, CARRD.co. We're also big on Instagram, TikTok. I post quite a lot on LinkedIn as well. But to make it really, really easy, you can also just send an email to info at rophemd.com. So that's info at rophemd.com, and we'll walk you through everything. So
Perfect. Perfect. I want to join. I haven't been the best at sticking to my New Year's, weight loss goals, and it's funny because what I'm finding is I have a lot of the peri. I know I look young. The perimenopausal stubborn fat that just won't go away, and you're trying to get that summer body on. But yeah, I would love, 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 love to be on one of your protocols. Guys, check out Dr. Assam. You've heard it here. She said she's located in Maryland. Definitely check her out. Dr. Assam, it was such a pleasure having you on after all these years. Who would have thought
who
we
would have
would be
thought?
here? You are such a blessing, such a pleasure to chat with. And she said that I have such a calming demeanor. That's her. She is so that's her description. As always, it was truly, truly our pleasure having you here. Guys, next time we will have another amazing doctor on. But as always, until then, take care. Bye. Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.